everyone, and we're back live here at the GuideWell Insights Lounge. This is Kate Warnock coming to you on location from the floor of the 2017 AHIP Institute and Expo. I am delighted to have a very distinguished guest with us, Mr. Charles Steller. Charles, welcome to the interview.
Thank you very much. It's a pleasure to be here.
We are so happy to have you. Charles has just a little bit of history with the AHIP organization. Why don't you tell us about what that was, and then tell us what you're doing with yourself these days.
Certainly. First of all, with the health plans and with AHIP, it's been sort of my entire career.
Okay.
And it's since the early 80s. Even back in the late 70s with predecessor organizations.
Okay.
So the great thing is I've watched the evolution and health plans working with consumers, health plans working with providers, some of the issues that we experienced in interoperability. And today I'm with WEDI, which is the Work Group for Electronic Data Interchange.
That's right.
It's a great opportunity now to put it all together.
And you're the president and CEO of WEDI.
That's correct.
That's right. And you even came out of retirement to take that position on, I understand.
Right. I think that taking a couple pictures of butterflies and sending them to friends created some, like, you need to go back to work.
Okay. But clearly something you're passionate about, Charles. So I know WEDI is happy and blessed to have you.
Absolutely.
Yeah.
I would like to sort of see, before I retire permanently, I would like to see many of these issues and problems become non-issues.
Well, let's talk about one of the
Sure.
big issues, Charles, prior authorization. Okay, so recent change in HHS leadership and the call for prior authorization reform sweeping our industry. It seems that we're at a point to really start talking more about prior authorization, bolstering dialogue, I should say, between payers and providers. Okay, what are some of the ways payers and providers can be brought together to not only discuss reform, but bring feedback on the topic of prior authorization?
Sure. We certainly hear a lot about this at WEDI. We had a great deal of discussions about prior authorization before I left AHIP. There was a fair amount of, well, it's the problem of the providers, from the provider perspective, no, it's the payers. And so it was somewhat finger pointing.
Yeah.
But the fact remains, when I went to WEDI, since providers, payers are all part of our membership and governance. So we have the dialogue there, as well as the government on our board of directors. So now I see, okay, well, let's get it all together. We can make it work.
Right.
So with prior authorization, we decided that we needed, in addition to the work group that we've had for several years at WEDI, we needed to maybe bring everyone together. So as a result, we established the Prior Authorization Council.
Okay.
And our objective was to find all of the various projects from organizations, provider organizations, looking at the AMA principles, looking at the work of whether it's X12, HL7, the cooperative exchange, looking at all of the NCPDPs and WEDI and saying, and the work of HIMSS, let's put it all together and let's see about getting the group together, and let's figure out where we have common areas of interest, issues, and where we might be able to come up with some solutions.
So you're really taking a collaborative approach. You're bringing all the stakeholders together, and you're providing that forum, that council that you mentioned is really that place that it can really be kind of hashed through, which I know that doesn't, we don't always have that kind of governing infrastructure to provide a place for people to come together. So what a wonderful opportunity.
This is a great opportunity.
Yeah.
It's also one of it's a fascinating process, because you see that everyone, no matter which side, they want to see us come to a conclusion that is much better between provider and payer, and that make sure that the consumer is in no way getting hurt by this process, that we are putting the patient first. And we're really, that is our goal, not to have discussions about, who's right or wrong.
You're moving beyond the finger pointing.
Absolutely. It's a great opportunity to put the technology process in action. You put the you look at processes to see whether you may have some problems in your process, your prior authorization process, and you try to come up with some solutions.
All right, we're going to pivot a little bit away from prior authorization. We're going to start talking about the move away from fee-for-service and more towards the alternative payment models. It really requires a vast exchange of clinical information. I think from your perspective, I'd like to know, is HHS going to mandate standards and protocols for clinical information exchange?
Well, there's a couple, I would suspect that will come in time. For purposes of, right now I think we're still trying to, HHS is establishing their priorities and
new administration,
and trying to really, and with Dr. Price, he's trying to look at the electronic health records and some of the obstacles that we have in collecting information. And then that's going to lead us into, well, how do we share information? And what are the obstacles? There's people throughout this exhibit hall that are here as, they have various solutions. And in these solutions, how do you transfer clinical data? What is the additional information? Sometimes the exhibitor has a product that helps us with our current process do it better. But let's clean it up. Let's find a way that we can exchange data, we protect the data, it's secure. The patient is in charge of the data. And because the interesting part of it is our data.
Right. We had, I have to tell you, Charles, we had Dr. Farzad Mastashari was with us beginning. He kicked off our live stream in day one, and he was wearing this lapel pin, and it showed a download icon, and it really was about it's all about people owning their own data. And I think that that's such a critical part of WEDI's mission too, is figuring out how to enable that sort of transfer of power. That's really what it is.
It really is. And to make sure that it's done in a way that the consumer has to also be careful how the information is used, who has access to it, making certain that you protect your own data, but certainly anyone who handles your data, that it is done so in a way that we can, as much as we can, assure that no one else is using the data or using the data inappropriately.
You lead me into my next question perfectly. In this era of digital health, we have this proliferation of digital health applications. What are your concerns as millions of people begin to load their personal and clinical data into these apps?
This is a significant issue. It's an issue because we trust an app, and we now realize that when we download to an email that we're getting, that we sometimes find out that is people are just trying to collect your information, scan your information. Well, with apps, we really don't know what's behind a particular app. What is sort of the standards they've gone through? Why is it that they are now sort of authorized to take all of our information, and we're authorizing them to do it? So I think there's part of it is how can we have a process to make sure that we have accredited apps? Maybe one way. Where we actually tie it together that says, I have apps. My apps are apps that will help me better take care of my own health care and help me with my providers. But let's make sure that we're not opening up our information
Right.
to the wrong people.
Right.
And so, there's a process of sort of deeming the apps that are part of, that we decide to partner with, we as a consumer.
Yeah.
We've got to have some assurance that we are only using the right ones.
So, is there any kind of effort underway for that kind of that verification that some sort of qualified app, it gets a check mark of some? Is that happening now?
There are processes. There's some various people, some even in this exhibit hall,
Okay.
that believe that we have to do something about the quality of the apps, the use of how apps can actually pull your information, and are they storing your information, or are they just pulling the information they need to report back on your exercise program,
Right.
or are they using it and possibly going too far on it? So there's organizations, there are people that have this as a desire that I've talked with that really want to make sure that we have only qualified apps that we're working with.
Right. Great to have those consumer safeguards in place.
Absolutely.
It makes so much sense. I've got one last question
Sure.
for you, Charles. So, you have, as you mentioned, decades of experience, and you've been through multiple administrations, different kind of health reforms, really seen this industry evolve and grow. Tell us, what do you think health plans should be focusing on in the next 12 to 18 months?
I think that health plans and providers, but let's just use health plans, so you raise that issue.
Yeah.
They are focusing on the consumer.
Rightly so.
We are the ones that are driving the information, and so number one, we think that it will be a more consumer focused.
Okay.
Depending upon how they purchase the care, whether it's done through their employer, whether it's done on the exchange, or some variation thereof. But certainly. You need the health plan is going to want to make sure that they are connected in with the consumer. The consumer has access to the information. They're able to transfer information that the consumer needs to better manage their own health care.
Yeah.
So it needs to be more of a partnership. And
Yeah.
I think that's what I see as one of the bright stars of the future.
I do too, and we've certainly had a lot of speakers reiterate that point. So, Charles, it was delightful having you here.
Thank you so much.
In the GuideWell Insights Lounge. Thank you for sharing your time and your expertise with us.
My delight.
Yes. Well,
thank you very much.
Thank you so much. Well, listen, everyone, we're going to be up with another interview in just a few minutes. I hope you keep watching. And we're back live here at the GuideWell Insights Lounge. This is Kate Warnock coming to you live on location from the floor of the 2017 AHIP Institute and Expo. And we have a great guest with us. We have Dr. Ed Buckley. Ed, welcome to the interview.
Hello, thank you for having me.
We are thrilled to have you, and we know that you have a session coming up, so we're going to keep this short and sweet, folks. But so Ed, you are the co-founder and CEO of PureFit. You have a really great topic. I was hoping that you could maybe tease it for our audience, and it's redefining wellness. What are you going to say?
Well, it's really our mission. It's our rallying cry at PureFit, which is the last 10, 15 years in wellness has kind of been stale. It's been an eye roll moment when you think of worksite wellness, and it should frankly be the most fun, the most easy, the most enjoyable aspect that benefits gets to do. So we just want to make wellness fun again, and that's what we're going to be talking about. What we're doing, what some other industry leaders are doing, and how you can get involved.
Well, let's talk a little bit about the PureFit model. Tell us what the company is.
Yeah, you know, the way that we look at it is individuals have been leaving big box gyms, right? They like these niche boutique studios, Orange Theory, the bar method, right? Hot yoga, but they have no way to use their wellness dollars to kind of hop around. So we built a digital currency where people can use their worksite wellness dollars to hop around to whichever studio they want to go to. Whatever in the mood to do, they get to do it.
Wow. And so really you're truly enabling that consumer choice.
Yes.
But you're keeping that motivation high because it's self-directed, and if they want to go to, like you said, Orange Theory one day and Pure Bar the next.
Yeah, what we always hear is, we heard this great line from someone one time that says, now that they have this, when they're in the mood to work out, they don't have to do something, they get to do something.
That's
right?
great.
It's really about them building their own personalized wellness journey.
Right, which is so paramount, and I know that's such a big theme. You know, we had Dr. Kyra Bobinet here yesterday, and it's talking about, you know, the neuroscience of choices and you know, behavioral economics, and really what you're enabling is you're really tapping into those consumers who are so self-motivated, or maybe want to bring a friend along and expose them to something else, and now they have a new way to do it.
That's why we call it PureFit, right? It's about you and your peers going and doing whatever you're in the mood to. This morning at the conference at 6:15, we sponsored a workout, and lots of people got to bring other people with them, right? It started with one person who kind of bullied everyone else to go, and even some of your team here at GuideWell was there bright and early to, it's positive peer pressure. How about that? Positive peer pressure.
Absolutely.
And because of that, you know, we had 10 people that were out working out at CrossFit this morning before we came to the conference. Right.
And health is social, so I think what you're really doing is just giving them another way to make that connection. So, all right, let's pivot a little bit, Ed. Okay. So we know that I think you said 6 years now into being a startup company that's no longer really a startup.
No.
I mean, you're really gaining some traction. But I have a couple questions for you. You know, how is it that someone that maybe they have a great solution, they have a great concept, but they look at the healthcare industry and they are just overwhelmed by the regulation, the intricacies, the challenges of really breaking in. How did you do it? What was your start?
I found a great co-founder is first and
Number
foremost.
one.
Have a great team, have someone who can counterbalance your strengths, your weaknesses, and really propel you and motivate you every day. Healthcare is overwhelming for the people who are already in it and the people who are trying to get in it, right? It's a complex, red tape driven industry, and they don't often look at disruptors in a positive way. So what I would say is find the people who need you, get close to them, understand you're going to be told no a lot, and just be persistent, be passionate about what you do, and the right doors will open up. They might not open up when you want them to, but they will open up.
You know, one thing that I've heard others say is that, you know, they may not understand, you know, you might have a great solution, but it might just be a point solution.
Yes.
You may not understand the context of really what the infrastructure is within the company. How is it that you came to understand how you plug in the right way?
A lot of years of being told no and figuring that out, right? So in the beginning, we thought that we have this great point solution, and why wouldn't you use it? And it took a lot of, when we were told no because X, Y, and Z, right? You start to learn what the ecosystem looks like, where you fit, and what the broader kind of politics and realities are of it. And so that's what you have to figure out, is how can we help other aspects of the ecosystem accomplish their goals? It's about everyone else and not you. That's really what being successful in this ecosystem, and a lot of them are, is how do we help every other piece be successful?
I have to ask, were you always a B2B solution, or was your business model perhaps B2C? Is that what you envisioned first? How did you
you can thank
arrive at
GuideWell
where you
for
are?
that. You can thank GuideWell
All
for that. So we're in HealthBox, first day of the accelerator, and at the time we'd built this flexible fitness pass. We knew that consumers loved it, they were buying it, and Renee talks to us and she says, you guys would be a great B2B enterprise health solution. And we're like,
Yeah, what?
please,
Yeah.
right? We'll humor this for the conversation. And she said, look, you're a great point solution, same thing. In our
Right.
broader ecosystem, we can use you.
Yeah.
And next thing you know, it's 3 months later, and we're full bore enterprise health, selling to employers, selling through brokers and carriers, and we've never looked back.
And really helped you to scale
So
much
thanks,
more
Renee.
rapidly.
Thank you,
Yes.
Renee.
Finley. Yep. Yeah, she's smart that way.
Yeah.
So, all right. Any other advice for someone that's looking to be an entrepreneur? What's probably the top lesson that you've taken from your experience?
It's what I've already talked about. Being passionate and being persistent. There is nothing short of that will get you to where you are. And the passion is because most days are hard, right? You're going to be told no. You're going to have things fall apart. You don't have millions of dollars behind you to kind of rest on. And so if you don't have that passion, then it's going to eat away at you. But if you do, you come in every day ready to take the next challenge.
Yeah.
And my goodness, with our team behind us and the passion that our whole team has, it's been a joy every single day.
Well, fantastic. Well, good luck talking about redefining wellness in your 4 o'clock session. I'm so glad that our folks here were able to hear a little bit more. And where can they find you on the web?
They can find us, really type in PeerFit, P-E-E-R-F-I-T, Twitter, Facebook, Instagram, Snapchat, we're everywhere.
Terrific.
Yeah.
All right. Well, and thank you for
Yeah.
joining us here in the GuideWell Insights Lounge. This is Kate Warnock signing off for just a moment. We're going to be up next with another interview. Please keep watching. Hi everybody, and we're back live here at the GuideWell Insights Lounge. This is Kate Warnock coming to you from the floor of the 2017, my goodness, I was jumping ahead, 2017 AHIP Institute and Expo. I have a wonderful guest with us joining. It's Dave Beal. Dave, welcome.
Hello, how are you?
You're very well, thank you. So Dave, your title, you are the U.S. Leader for Health Plans Consulting at Deloitte.
That is correct.
Yes, and you just came off the stage. I'm so glad that you're joining us. You know, you have a very interesting I'm sure you had an interesting conversation. What is the payer's role and value proposition in this evolving healthcare environment? Let's throw that to you.
It's a good question.
Yeah.
So if we look out in the future, I think what we see is that payers who are largely been transaction processors to date, that world is evolving. That there's a lot of innovation, automation, robotic process automation. So much of the transaction processing world is really, we think, is going to become much more automated, much more modernized, much cheaper to deliver. Mm-hmm. Eventually, as innovation really takes hold, it'll move, we believe, at some point to the cloud. Will payment processing and benefit determination and most of the very manual-esque transactions that are done by these large systems will be done in the cloud and be done largely for free. So the payer's role is going to change a lot. The payer's going to become not just a payer anymore, but they'll become a partner with the consumer to help them navigate their health choices, connect and aggregate their connections to the ecosystem, and help them make the right health choices over time. So from transaction processor to aggregator and curator is really where we see it going over the next 10 years.
So it really sounds like there's an opportunity for the health plans to start truly having a relationship with their members. So instead of it just being transactional and kind of behind a wall, maybe now it's more personal.
Yeah, I think what we see is not just a relationship with their members, but actually tightening the relationships across the whole ecosystem.
Okay.
So the individuals, the members, and the families, they definitely, I think, are trying to get closer to them. They've been trying to do that for a period of time. But I think we see a lot more collaboration with the provider community, closer than just contracts and payments,
okay,
the way it used to be, and networks. But a more integrated, we see a lot of what we call vertical integration and virtual vertical integration, and payers and providers trying to work together a lot more closely, but also employers and other partners who are outside, have been traditionally outside the ecosystem, if you will. Payers are starting to really try to, I won't even call them payers, I'll call them health plans,
yeah,
are trying to embrace them a bit more closely to bring all of that to bear for the consumer.
Well, it sounds like the consumer is really going to win in this kind of new scenario that you're painting. Yeah, hopefully. Well, let's talk a little bit more. You were talking about some of the business trends. Let's talk the tech trends that you might be watching. What's going to be helping with this transformation?
So we're seeing there's so much. There's so much. There's been a really huge movement around what we call digital transformation within the core of the health plan. So if you look at the health plan's infrastructure traditionally and systems, they're large mainframe, big, heavy, monolithic technology systems that do all of this payment processing, right, claims processing, benefit determination, and all that stuff. And that's been the case for 40 or 50 years. And those systems are hard to maintain, costly to maintain, difficult to modify and make changes, and they create a lack of nimbleness in the marketplace.
Absolutely.
So one of the things that we're seeing a lot of is the desire, not just the desire, but now the action around modernizing those systems with new technology platforms, cloud-based computing, then adding in some real technology innovation like cognitive computing, machine learning, AI to help enhance some of the business process. And as we were talking about before the session started, people are afraid their jobs are going to go away and be taken away by the machine.
Right.
I do think that there's going to be some level of additional automation that will render some of the traditional processes, if you will, that have been manual,
right,
that will become just automated.
Yeah.
And I don't think that means jobs go away. I just think that means we can focus people's value on more our time on more valuable things.
So Dave, I'm wondering, in your role, you're head of the health plan practice for Deloitte. How is it that you advise these executives on what to watch? How do you help them prioritize where they should go next?
Yeah, well, I mean, we look at four main pillars within the health plan trends, if you will, that we don't really have to, the truth is we don't have to tell them what to look at that much because it's really obvious what's happening. We think there are four significant trends. There's a trend around affordability. It's one of the problems that we've still not solved despite all the legislation and proposed legislation. So value-based care, collaborations with providers and other ecosystem partners to drive down the cost of care, manage care, and be proactive about care management is a trend. And there are a lot of innovations around collaboration. There's a whole set of innovations around technology and digital transformation that we were talking about, and that goes beyond just modernizing the core. There's more to it than that, but analytics, digital, there's a whole set of trends, and we encourage our clients to look outside of the traditional players. So let's look at the tech giants like Apple, Google, Facebook, Optum, others who are doing very interesting things with technology and bringing that to bear that we think will change the game for the consumer and should be looked at from a health plan capability perspective. There's a whole set of things around government programs. There's going to be 30 million Medicare new enrollees over the next 10 years, and Medicaid is obviously looks like it's going to be changing potentially depending on how legislation plays out. So that's a huge market for all health plans. That's where many consumers are going to have to go because they're just aging in. And so there are a lot of trends around Medicare Advantage and Medicare Advantage capabilities, being able to deal with those and work with the cost of care. And then the last is just the digital consumer and making sure that you're staying up to date with how to connect best with the aging Medicare patients who are actually, those who are going to age in the next 10 years are going to be so much more connected than the Medicare members today. They're all in the workforce, they're all connected, they're all using their devices. Then you go to the other end of the spectrum and you've got the teenagers of today. So like my son, who's going to be he's going to access the system, but he's going to expect to do it in a connected and ubiquitous way all the time. He's going to want to be able to talk to the answer, make it happen, and so I think that those capabilities for the consumer are going to be really important.
So it sounds to me, with these four pillars that you speak to, that you probably are a proponent of dual transformation, and by that I mean we're in a business that has this legacy skill set and their core business, as you said, they need to do more than just modernize. They need to bring that up to as current a state as possible, yet need to continue to maybe innovate beyond their core capabilities. So as you said, look at the other industries and what they're doing. Is that something that you really do you espouse that? Do you think that's the right approach for most health plans to take?
I think it's the only approach for the leading health plan to take, honestly, because I think healthcare is going to go in that direction. I think you need to keep the business running and maintain your base and your core, so there's an aspect of doing that. But I do think that there's going to be innovation, significant innovation and disruption. It's hard to predict disruption, but if we were to be to do a little speculation, I think we would say that there are going to be a significant set of new capabilities that are brought to the market by health plans who are partnering with new ecosystem players like the tech giants. And so I think the dual play is a necessary strategy in order to maintain relevancy in the future.
But you're seeing that really through convergence, so that's interesting.
Well, when you say convergence, what do you mean?
Well, convergence in that, so if I'm a health plan, but I'm going to partner with maybe someone outside of the health industry to, that might own that new capability. We're going to we're going to provide a health application.
Absolutely. So I would say convergence on levels that we've never seen before, and I actually think that the fact that the mega mergers that have come to pass or didn't come to pass in the past 18 months to 2 years, I think that was a clear sign by the Department of Justice and the federal government that to scale and to continue to stay relevant as a health plan in the industry, you can't just sort of swallow each other up. You need to go out and find new and different ways to engage customers, consumers, and other ecosystem partners. So we've seen just a resurgence of partnership models between not just providers and payers, but payers and all kinds of players, tech companies and drug companies and you name it, retail out stores. And so I think there's a clear sign that there needs to be a lot more collaboration to make this new model work and for the innovation to come forth.
Well, it's a really interesting time to be in healthcare.
It always is, but this is the best.
Yeah, absolutely. Well, Dave, thank you for sharing your expertise with us here in the GuideWell Insights Lounge.
Thank you very much.
I'm happy to have you. This is Kate Warnock. We're signing off for just a moment. We're going to be up next with another interview. Please keep watching.
Thank you.
everyone, and welcome back to the GuideWell Insights Lounge. This is Kate Warnock, and I am coming to you live from the floor of the 2017 AHIP Institute and Expo. Right now we have another wonderful guest, Mr. John Lovelace. John, welcome to the interview.
Thank you, Kate. I'm looking forward to being here.
Well, we're glad to have you, so let me read everybody your title. You are the president of UPMC for You and the president of government programs and individual advantage for UPMC Health Plan. So you flew into us from Pittsburgh.
Yep.
That's great, and you had a safe flight and everything.
I did. It was the one plane, you don't have to change planes, so it was a great treat to not have to change planes.
Oh, nice. Direct flight. All right. Well, we've got a lot of questions for you, so we're going to dive in here.
Okay.
So Mr. Lovelace, we're seeing more attention being paid to social determinants of health in research, media, and even advocacy. What would you say accounts for this surge in interest?
I think we just had a session on this actually. I think one of the great pushes on this has been the realization that some of the limits we reach when we're trying to help people improve their health are not really medically related. They're really more related to things outside the medical side.
Sure.
So as my colleague on the last panel actually was saying, is you have blood pressure control at 90%, you just can't get that last 10%. And it's really not because the people are different, it's more because the people have other challenges.
Absolutely.
They don't have a place to live, they don't live safely, they don't have enough food. So I think more awareness of that issue of how your life affects your health, not a surprise when you think about it, has really brought this issue a little more to the forefront. It's also it's not a new idea, it's really more a new term.
Right, right. I know that population health has really been community-based for so many years, and now the health plans are really understanding. They have to understand their population to be able to provide better kind of care.
Exactly, and a different way of thinking about people, different way of thinking about the work.
And holistically too. So, all right, so I'm interested in hearing your response to this next one. So, the Bipartisan Policy Center issued a report this year with this statistic. Medicare patients with 4 or more chronic conditions comprised 70% of Medicare spending in 2010. That was the most recent date they had. How can we better manage the health of this population, especially as more boomers age into Medicare?
Yeah, it's having already done that myself, I've already aged into Medicare. I think it really involves taking a much more holistic view of health risk assessments, how you engage with people in the beginning, what kind of data a health plan looks at as people come in the door, what kind of previous history do people have, and talking to people, listening actually more than talking, listening to folks. So my co-presenter at the earlier sessions, it was a Kaiser, they called people who are very higher users than this, the top 1%.
Right.
And the question started was, how can we help you? Not, here's what you should do, not you should manage your diabetes better, but how can we help you? And the answers are often things like, I need a railing because I can't get out of the house safely. I'm afraid I'm going to break my hip.
Yeah.
So I think it's really taking both from the practitioner perspective and from the patient perspective, more of an openness to think about most of what affects the outcome of your healthcare is not your medical care. Right. Most of what affects your healthcare is your life.
Right.
And being more aware of that and where you can intervene, how you can help people think about that differently is where we're going to move, I think. This problem will get worse, not better.
Absolutely, and I liked what you said. We've had many other guests here at the Insights Lounge say it's really more about listening and understanding the values, maybe even of the individual that you're talking to. It's not just a one-size-fits-all sort of care delivery anymore, is it?
It probably never should have been, and probably never was, but it certainly is. There's more of this. There's a world beyond healthcare. Healthcare is our world.
Right.
It is not most people's world.
Right.
It's just one more thing, one more thing in life. So that's a nice opportunity to move forward, I think.
All right. Well, let's hear your thoughts on this next one. So we know that mental health can be a multiplier of the challenges faced by the socially vulnerable, in particular. How do we begin to close the gap in providing access to mental health care?
I think a couple things. There's always an issue about stigma in mental health care. It's an embarrassment. It's a failing on the person's part. So there's a cultural thing to address. Most traditional mental health care is done over here. There's sort of health care and there's mental health care.
Right.
Different providers, different practitioners, different rules, different payment streams. So I think there are two short answers to this very long question.
Okay.
One is, particularly for people who have serious mental illness, serious substance use disorders, is I think integrating primary care into the specialty center. I think is one potential solution for some people. So you move your primary care into your mental health center, not expect the mental health patients to move themselves into primary care. For some people. The other, of course, is embedding more behavioral health expertise in medical offices. So that could be for treatment purposes. So you have I'm the physician, and when I'm done, you might want to talk to the counselor next door. It could be that.
Right.
But some of it more probably is influencing how the practitioners of physical health care practice. What should you be asking people? If people aren't adherent to their diabetic regime, what makes that hard? It's not because they don't want. It's not because they choose to be disadherent. There's something not safe to walk outside. You can't afford the better food. You can't afford your diabetic test or whatever it is.
Right.
There's more sort of influencing how people ask questions, taking more time with people who have troubles and struggling, and getting for a lot of people, it's patients particularly. I think it's an issue of feeling I don't want to waste the doctor's time, or you say yes when you really mean no, but yes because you're nervous, you want to get out of there, and you just say yes.
Do you think the primary care physicians are willing to kind of more move into that dialogue that addresses more than just you came in for an ailment, I'm going to talk about the ailment? Do you think that they're ready and prepared to take on a more holistic view of their patient?
I think people would be happy to do that. It's really driven by reimbursement. So if you're paid on relative value units, then you have to produce them.
Yes.
At the earlier session today, I heard that there's Oscar and IORA were presenting different disruptive primary care models.
Right.
And the whole value premise in IORA particularly is we are capitated primary care doctors. We invest in our patients a self-Medicare Advantage early on because we will save tons of money in the next 10 years for the 11 years our patients are with us by investing money and spending half an hour with people when they come in, not 6 minutes.
Right.
And trying to get around that. What else ails you, sir?
Right. So intercepting before it goes downstream and becomes much more expensive and certainly a much bigger challenge for the patient.
Exactly, and of course, 10 years later they're sicker, right?
Right. Absolutely. All right. So John, we have one more question for you. So, what is the best first step in making healthcare more equitable and equal for this population?
Well, that's a nice question to finish up on. So I think the movement toward patient-centered medical homes as a way of delivering primary care is a large step forward. It takes more. It assumes there are more things to deal with than just I came in for a sore throat and I'm going to go home.
Right.
Giving people more time to more of a team to interact with than just the doctor. So people have maybe have more time to listen, have more expertise in social work or in community health work or in nursing rather than just rely on the physician to be the center and the sole provider of everything.
Right.
With helpers.
Right.
This is more about an equal team with different strengths and different
the care
avenues.
Team. And that care team model, it does seem to be really viable, doesn't it?
It does.
Yes. All right. Well, John, thank you so much for sharing your expertise with us here in the GuideWell Insights Lounge. It was delightful having you.
Oh, thank you for the invitation.
All right, our pleasure. This is Kate Warnock. We're going to be up with another interview in just a minute. Keep watching. and we're back live at the GuideWell Insights Lounge. This is Kate Warnock coming to you on location at the 2017 AHIP Institute and Expo. And I've been waiting all day to introduce this guest to you, Mandy Bishop. Mandy, welcome to the Insights Lounge.
Oh, thank you so much for having me, Kate. I'm thrilled to be here.
We are psyched to have you. So, Mandy, you are in a brand new role with a company called Lively Insights. You are the founder and CEO. So we have a lot to talk about. Let's get to the questions.
Excellent.
All right. Awesome. So you have this amazing background in healthcare IT. I'm wondering if health IT helped you become a health equity champion that you are today.
You know, it's interesting because I think that my role in health IT and thinking about that in terms of health equity, it prepared me, understanding both from a technology perspective how much room we had to grow as an industry so that we can fully take advantage of all the opportunities that exist with health IT, and how we were not being very equitable amongst ourselves within that health IT space, right? So we have our big 800-pound gorillas in that space, and we have small scrappy vendors, and trying to come up with how best to create a sense of equity within the industry was interesting, and then applying that to the human health equity and understanding the health disparities when you're analyzing the data and you're analyzing the ability of the providers who are having to implement health IT and who are having to move forward with making health IT usable within their practice. And you think about those who are serving the most underserved populations. You think about those who are serving the most at need, and the fact that their funding mechanisms are not necessarily adequate to support health IT that would be in the best interest, health IT infrastructure that would help them address the needs of those underserved populations and help them reach parity with some of their larger practice peers who are perhaps not, working as much within the underserved populations.
Sure.
Yeah, so it's interesting that there is a synergy between the lack of equity in the technology itself and that translating to a lack of health equity in the communities where those providers who may not necessarily have all the advantages of health IT that larger practice areas do. It worked out to have a really synergistic quality and was kind of a natural extension for me.
How about it? Oh my gosh. Well, let's talk a little bit about Lively Insights. Let's see, did you help fill that gap? What are you doing with Lively Insights?
Yeah, absolutely. So with Lively Insights, we are taking a behavioral economics approach to population health management. So we are applying social determinants of health data to optimize population health. So we want to be able to help you understand. I once had a CFO of a large hospital system in California ask me why only 14% of his CHF patients in his attributed population were compliant with their treatment regimen. So 14% in his CHF. And I said, well, did you ask them? I mean, that's an honest question. So if only 14% are compliant, clearly this is a population health program that is not succeeding, right? So this is not effective. So when something isn't effective, you should absolutely take a look at the root cause analysis and try to understand why is it not effective. And typically right now, our population health, we're still in the nascent stages of understanding populations as anything other than a single disease state. So understanding the social determinants and all of the reasons why an individual may or may not be able to comply or adhere with the treatment regimen that's put forward, or whether or not that's the appropriate care plan for them to begin with, right? So understanding and answering that question for me became kind of an obsession as to understanding how can we get better information that can be actionable for the people who are designing population health programs, people who are designing community engagement and outreach programs, so that they can be much more effective at actually helping people learn how to manage their health and meet them where they are and understand the challenges and motivations that will help them be more effective at their own health management.
And you do that, in your spare time. No.
No. I do the social media ambassador gig in my spare time. That's my day job.
That's right. So if you've been watching, if you've been following AHIP Institute, the hashtag on Twitter, on behalf of Mandy Bishop, she shares just wonderful information. So I hope that you follow her. You are Mandy B Pro on Twitter. So
indeed, and Mandy with an I.
Mandy with an I. Very important to realize that. All right, let's move on to a related question here. So recently, you shared a little piece of content on LinkedIn, and it's clocking in at around 400 likes on LinkedIn. And of course, LinkedIn is a professional community. This was a graphic that really took kind of a complex piece of information, made it visual, and therefore very consumable.
Exactly.
Yes. So tell us why the health industry really needs to pay more attention to what they're presenting to their members, let's say.
Absolutely. Yeah. And that was a great example. And it was indeed a share that I picked up from you, right? So I picked up this beautiful, very simple data visualization about all of the factors that influence mortality rate.
Right.
And all of the social determinants of health that influence mortality rate, as well as the clinical factors that are influencing mortality rate. And not surprisingly to me, so many of the social factors were larger. Things like war were included,
Yeah.
Understanding of famine, smoking, all of these lifestyle and external and environmental factors that were included. And it was a simple visualization with the size of spheres on a page, and so the relative
very
size.
Colorful. It was very colorful.
Exactly.
Too, yeah.
So that the color and the size, but very, very simple graphic. And that type of data visualization, you instantly understand the information. You understand what it is that they're trying to deliver without having to read a 30-page report. So if you think about something like the 7-minute office visit that a physician has right now, right? So your clinicians only have 7 minutes in front of their patients. So as a physician, what if I could look at a visualization like that and I could see in a red light, green light, yellow light, whether or not they're likely to be food insecure, whether or not they're likely to have housing instability, whether or not any of the transportation challenges that would impact their ability to come to the next appointment would exist. So instead of having to read about that patient, I were able to see instantly whether or not these things were applicable. Your brain can process that information much faster, and it just allows you to continue to remain in your workflow. So I'm going to give a shout out to Chuck Webster on the workflow, but it allows you to operate within your existing workflow, and it allows you to process information and make it actionable instead of just having yet another data stream with yet another report, right? We're inundated with data. We don't need more data. What we need is information. We don't need more data.
Absolutely. Absolutely. All right, next question for you. So I had to throw this out at you. So Thomas Getz of Iodine wrote recently of how the health industry, and this is his word, is allergic to disruption and resistant to systemic change. As a successful health industry entrepreneur, would you agree with that opinion?
I think that allergic is a very, I think that's an appropriate way to put it, and I know that there are a number of others, Rick Scott included, interestingly enough, and I'm from Florida, so as you are, and saying that why would an industry cannibalize its own revenue? So in talking in terms of healthcare transformation and truly going from sick care to well care, and why there's so much resistance to making, true transformation possible. You have to make sea change. So I think that we are allergic because right now we are still clinging to traditional healthcare. We're still clinging to a hospital model. We're still clinging to needing to have beds filled, right? Those are the revenue streams that we know and understand, and we're still clinging to every action that we take as a system. So across the health plans and the provider system has to be tied to a reimbursement methodology that we understand and recognize. And so Jamie Haywood said this morning at Patients Like Me, he was talking about the fact that the system is so broken that it's not worth it anymore for him. And I think that is a way of communicating that same kind of allergy, right? And allergic to disruption. But it is really hard, and Shahid Shah talks about this a lot, it is really hard to disrupt a $1 trillion industry. It's very hard to disrupt $1 million industry, and then even harder to disrupt a $1 billion industry. And so to truly disrupt a $1 trillion industry that represents 20% of the United States economy is seemingly insurmountable. So I think that allergic is a nice way to put it, but I do think that the sea change, there will reach a tipping point at which some of the key players in our industry, some of the large players in our space, are going to understand that new revenue streams and a completely new business model is what's necessary in order to discontinue our current trajectory on the cost curve, which is we all recognize is unsustainable. But in order to make a sea change, we're going to have to completely develop a new business model and give up the idea of hospital beds. You give up the idea of health insurance as health insurance, right? And start to think more about how can we leverage data analytics? How can we become more analytics-driven organizations? How can we become information providers? How can we give that information to consumers to help them make better health choices and start to identify with new revenue opportunities that will take up that space? But in the meantime, yes, I'd say we're highly allergic.
Yep. All right. There you go, Thomas Getz. You have Mandy on your side.
Yeah.
So, all right. My last question. We have one more for you after this. Okay, so again, going back to the health equity conversation, The Lancet published a series on health equity and inequality this year and concluded that not only are poor people earning less, they're living shorter lives compared to their wealthier counterparts. So just stunning information that they shared. How can the health industry address factors that might be beyond its control? Social determinants, right? So, you have someone that's in front of you for 7 minutes. How are you going to go back and make sure that their housing is secure and that they have food in the pantry? Well, what can we do?
Yeah, and there's I think that taking responsibility as healthcare providers is probably not likely to happen. It's outside of their purview, but I think understanding those factors, and I think uniquely, as we're sitting here at AHIP, the health plans have a real opportunity here. They are already the hub of longitudinal patient data, right? So if a member is within your system, then you have more information about that member than each one of the providers that member sees, right? So you already have this longitudinal data. You're already a community member. You're already a large community stakeholder, and you operate with many of the healthcare providers and healthcare stakeholders in that area. So why not encourage health plans to become stewards and to become leaders of community service coalitions and community stakeholder coalitions, so that they can start to bring together all of the people in a community who would influence the health of that community's members. So I think that is where an opportunity lies for us to start to address it. So it's not that we can start to take accountability for making that change, but I think we can take accountability for understanding that health is an economic imperative, right? We require healthy community members in order to have a workforce, in order to populate those employer health plans that we want to be able to optimize. So it is an economic imperative that we begin by understanding and encouraging healthy communities, and so health plans are really uniquely positioned to be drivers of change within their communities, and expanding a definition of caregiver beyond the healthcare providers out into the communities themselves, and working with faith leaders, and working with grocers, and working with the Department of Parks, right? So Parks and Recreation. I want to see Leslie Knope coming to community health board meetings.
She would solve it in a day. Yes,
Leslie Knope would totally have this done.
She would, totally.
She would, but so I think that those, understanding that there are health disparities, and understanding that there are health equity issues that result from health disparities. I think that we can begin to at least identify some of them that may be impactable, but we're not going to be able to be effective at impacting them unless we have that full engagement from the community.
Right. Well, it's interesting that you suggest that the health plan really could be the lead on that, and again, with understanding the member over a matter of time, and seeing all the connection points. I think that's a role that hopefully a lot of health plans would be willing to walk into.
Yeah, it's in our best interest, right? So as the health plan, it is in our best interest to reduce claims experience.
For sure.
Right? So as a health plan, so you reduce claims experience by having a healthy member population, and by encouraging healthy behaviors, and you can do that by leveraging these types of community relationships and working together as a community to make the entire community healthier, because whether they're your members or not, if they're in your community, their health impacts the health of your members. And so collectively, community organizations and businesses, we all need to be healthier as the economic imperative of our community that's going to improve the health of our plan.
Right.
Yeah.
All right. One last question for you then, Mandy. All right. So as speaker at AHIP, we'll talk of the need for a healthcare moonshot, a seismic shift in the industry. We were just talking about this. From your perspective, what area of the health industry is most in need of a moonshot?
I think it's this that we've been talking about, right? I do.
Yeah.
I really do. So if you take into account that 80 to 95% of what influences health happens outside of a clinical setting.
Right.
So that's that number. It depends on the study that you read, but it's anywhere between 80 to 95%. And so we can't truly impact the cost of healthcare if we don't address that 80 to 95% of the factors that are outside of the healthcare system. So I think that the moonshot is understanding and identifying ways to make all of that information available, and ways to identify impactability. What are we able to influence, and to act on that? And I think that that's the area, being able to act at scale. I heard a wonderful presentation, I know you and I both heard yesterday, from Kyra Bobinet.
Yes.
Right? About the neuroscience of design thinking applied to behavioral economics. And I was thinking about that process, and to do that at scale, to be able to apply the neuroscience of design thinking to behavioral economics, and to each individual in a community at scale, being able to understand what's going to motivate you to change your behavior, and how do I help you plan for relapse. Once we're able to identify all of those social determinant factors, the 80 to 95%, and once we're able to apply this neuroscience approach to design thinking, to behavioral economics, I think that is the seismic shift that is necessary, and that is the moonshot that I want for us in the next decade.
That sounds pretty amazing to me, and I think it makes it just sound so much more exciting to be in healthcare, Mandy. And I think that with people like you, not just being a social ambassador, but really leading these conversations and having the conversations that you do with leaders in the industry. Maybe we have a chance at this moonshot happening.
Thank
So,
you. I
yes,
sincerely
yeah.
hope so. I plan to be part of it.
Yes, absolutely. Well, Mandy, thank you so much for sharing
Thank you.
your wonderful insights with us here at the GuideWell Insights Lounge. This is Kate Warnock. We have another interview coming up. We'll be back soon. Thank you.
And the shots to there, is it?
Hi everyone and welcome back. This is Kate Warnock coming to you live from the GuideWell Insights Lounge. We're here at day 2 of the 2017 AHIP Institute and Expo. I'm delighted to welcome to the Insights Lounge Mr. Ben Pring. Ben, welcome.
Hi, Kate. Nice to be with you.
We're happy to have you. So Ben, you have had a long day. You spoke early this morning, but let me tell everyone who you are first. You're the Vice President and Director of the Center for the Future of Work for Cognizant.
That's right.
All right, well, let's talk about the future of work.
Yeah.
So tell me, where might the health industry first see digital forces transform operating models, and which jobs will be obsolete and which will be burgeoning? So
sure.
big question.
Yeah, big question. I mean, I think you're seeing it emerge, digitization emerge in lots of areas already, and you can really look across the spectrum of the healthcare industry, from clinical diagnostics through to the customer experience, and then through into the back office operations of a payer or a provider. And so you can see examples of where next generation technology and increasingly artificial intelligence and machine learning is playing out. I mean, some examples which are increasingly well known are in MRI diagnosis and reading, where machines are outperforming even the best humans. We're working with a number of organizations that are beginning to deploy virtual reality into training of surgeons. I was down in Brazil a couple of weeks ago talking to the folks at Einstein Hospital down there, and they're already using VR to train surgeons, which is extraordinary.
Do you know Shafi Ahmed?
Yeah.
Shafi Ahmed over in the London School of Medicine is a pioneer in that, isn't he? Yes.
Yeah. So there's lots of examples of that. There's a lovely phrase in the sort of the futurology industry that somebody said a few years ago, which is that the future is here, it's just unevenly distributed.
Right.
So you can see that unevenly distributed in lots of places. Where we think that there's a huge opportunity, though, is perhaps in some of the less glamorous and some of the less sexy areas, but in the back office of big organizations, which not exclusively to the healthcare industry, in lots of industries, financial services, insurance, is really quite dysfunctional when you get under the hood. A lot of technology which is aging out, skills that are aging out, and really rife for reinvention and rife for disruption, and all with the goal of making things better, ultimately.
Right.
So to your question about skills and jobs going away, certainly we think that there is going to be a class of skill and job that does get replaced by software increasingly, and you can broadly characterize that as the rotes, as the routine, as the sort of low value added work where people are basically impersonating robots.
Right.
So let's in fact use robots and free up people to do higher order work, more valuable work, more productive work, more enjoyable work. And again, I think that's the strategy that we're working with a lot of clients to deploy. It isn't about large-scale replacement of people. It's about deploying them in more efficient, more productive ways.
Well, it sounds like that's a win-win, isn't it, for the organization and for the individual?
Yeah, we say fear not the bot. The bot is here to help you.
Yes.
A lot of people still do have that fear, and some of it's understandable. But we think over time, as the shock of the new becomes less shocking, we'll get used to this, and we'll realize that these tools are really just the next generation of productivity tools, and they're here to help.
Terrific. All right, let's ask our next question for you. So, all right, Ben, as the global WannaCry ransomware cyber attack proves, many organizations, especially those in the health industry, are using older and outdated operating systems. How then do we feasibly move into the world of integrating AI, this next gen technology, into these same companies?
Well, the WannaCry attack, which is just the latest of a very large long-standing series of attacks. I mean, it literally does make you want to cry, hence the name.
Yes.
And everything that we talk about in the Center for the Future of Work, all of the work that we're doing with our clients, all of the things that people here at this conference are interested in, all are built on the need for the next generation of security protocols. The reality is that the battle between the white hats and the black hats is going to be with us for time immemorial. And it's up to us as leaders, it's up to the people listening, those as responsible leaders in their organization, to realize that they've got to take this much more seriously than they have done historically. When you look at stats about the amount that is spent on cybersecurity in large organizations, it's almost shockingly small. Shockingly small. Big, large organizations whose very business, their very existence, is predicated on being able to exist in this new digital environment, which isn't going to be uninvented. We're not going to put this back in the genie back in the bottle. We have to deal with it. So it really does require organizations to know that they've got to step up to this. They've got to invest more in this. They've got to invest in replacing aging technology, which oftentimes, as with the WannaCry examples, is a wide open back door for people to get into organizations. They've got to replace this with new next generation technology, which is by and large much more secure. So it's really important, and I think a lot of people have had half an eye on this and have basically been in denial and hoping this isn't going to happen on our watch, and hoping we can think about more enjoyable things. And the reality is they can't. They have to address this head on, and the companies that do are going to be the ones that progress and move forward, as we were just saying earlier on, and the companies that continue to sort of put their head in the sand a little bit,
it will catch up.
It's going to catch up.
Yeah. All right, our next question for you then, Ben. With scholarly articles titled such as "The Dark Secret at the Heart of AI" and "AI versus MD," it's obvious that artificial intelligence suffers from bad PR. How would you rewrite the press?
Well, I think Hollywood's to blame for this, really.
Okay.
I mean, the dystopian view that Hollywood feeds us, based on the literature that a lot of people have written and sort of predates the movies. I mean, it's understandable. As I said earlier on, we have a human predilection to be scared of the future. The future is always a bit shocking, and it's more fun as a dramatist to tell a bad story. The protagonists are always the baddies in movies, and so it's very easy to paint the Terminator or the lady in Ex Machina as a baddie. The reality is that that sci-fi vision, it's simply that. It's a sci-fi vision. And what we try to do in the way we talk to our clients and the way we write about it in the book, What to Do When Machines Do Everything, is point out to people that there's no real logic to worrying about things that are 20, 30, 50 years away. These sci-fi visions. The thing that people need to worry about is 20 months away.
Right.
Is about using these tools, this technology, to improve your business or improve the business unit you run or the care that you provide. Because if you don't worry about that in the next 20 months, you're not going to be around in 20 years to have that debate and see whether those dystopian visions were true. And of course, again, if you put this into a historical context, we all know that today, 2017, watching Mr. Comey earlier on today, we live in neither a dystopia or a utopia. The real world is a mixture of both.
Sure.
And we know historically the past was neither utopia or dystopia. People fell in love in the midst of war. Dr. Zhivago.
That's right.
So why do we imagine that the future is going to be either or?
Okay.
It's not going to be either or. It's going to be a mix of good and bad. And so our book is really AI for pragmatists. It's for people who realize this is a tool, and it is a tool that you can master. And if you master it, you're going to do very well. If you struggle with it, if you ignore it, you're kind of missing the train.
All right. So if what most of you are doing in your role, Ben, is you're talking at that executive level and you're guiding them and thinking of the future of the workforce. How about, let's take it down a little bit lower than that. How about today's workforce? Especially the folks who might be retiring in 15 years, let's say, not necessarily looking for a brand new career or having to go back to school to learn a new skill set. What's your advice for these folks?
Well, the first thing, and it's a very good point. We call this in the book, we call this the brass wall. When the police department was modernized in New York in the 80s, the senior politicians, the senior police chiefs wanted to recognize, the force was in bad shape and wanted to change it. The next generation, the young guys coming in, the new cadre wanted to change things. It was the middle rank, the people who had brass on their shoulders, who wanted to maintain status quo.
Yes.
And the reality is, to your question, if you've got 15 years to go to the finish line, your 401k,
right.
If you imagine that you can sit there like King Canute for 15 years and hold these forces back,
right.
I mean, time out, that's a bad spot to be. Maybe if you've got 2 or 3 years, you could do that.
Right.
15 is too long. This is
Right.
changing too quickly. And the reality is that I think the way I look at it, I mean, I'm 55 years old, so the way I look at all of this is through my kids' eyes.
Yeah.
I call them my future of work focus group at home. And I think a lot of people who are in that generational kind of demographic, they've also got kids at home. They should be looking at how their kids live. They should be looking at how their kids are socializing, working, experiencing the world, and recognize that that is the future of work.
Right.
We look at a lot of kind of consumer technology and we think it's kind of stupid and crazy, but that is the future of work. And so I think for a 50-year-old, a 45-year-old, a 55-year-old, trying to inject that sensibility into your business process, into your customer experience, into your employee experience, that's the work that anybody can do today.
Right.
I mean, you may not personally like that.
Right.
That may not personally be appealing to you, but that is the future. One of the analogies I often draw in that sort of discussion is to think about how the record industry or the movie industry does it. The senior people in those industries, they're not making movies or records for themselves. They're making it for the next generation. So they're not producing those movies, those records. They're simply green lighting them, financing them,
Right.
steering them.
Right.
And again, I think that's a good analogy for senior leaders in lots of industries, including this, that if you're constantly thinking we're trying to make the solution for me,
Yeah.
make the record for
Yeah.
me,
Yeah.
you're missing where the market is and where the market's
Absolutely.
going. So I think trying to sort of rub your tummy, pat your head at the same time is very difficult. But again, I think that's the opportunity that senior people have to recognize the world does change, to recognize a lot of new stuff. Virtual reality, augmented reality kind of seems stupid as it emerges as a technology, but then cloud computing 20 years ago was stupid.
Right.
When I started writing about cloud computing in Gartner 20 years ago,
Yeah.
people thought I was an idiot.
Yeah.
But now cloud computing is the underlying technology that's changed everything,
Right.
and that we're all talking about at this event here today. So I think trying to recognize that the world does change and that you can't sort of time out, you can't hold progress back, that's the way you can remain relevant. A lot of people talk about, the digital natives, the millennials.
Yes.
For people like me, I like to talk about us as being the perennials.
You heard it here.
You heard it here
love
first,
it.
yeah.
That's right. I love it. Well, I think too what you're speaking to is that there's always an opportunity to learn. And as you were progressing, and maybe in the beginning part of your career, certainly you were open and receptive to new ideas, new technologies, that you never really have to lose that sort of curiosity and to your point, relevance, and take that wisdom that you've accumulated, really maybe kind of start to pay attention to the new way work is being done, and really make a name for yourself.
Well, one final lovely quote I always like to throw at it, Pablo Picasso said in 1968 that computers are useless, they only give us answers. And so the human ability to ask the questions,
Right.
that's how you remain relevant.
That's right. That's right. Well, I'm sure you gave your audience at 7:30 this morning so much to think about, because I know you certainly have here in the GuideWell Insights Lounge. So Ben, thank you so much for your
Thank
time
you.
and this wonderful conversation.
Great
It was
to talk to
wonderful
you.
talking with
Thank you very much,
All
Kate.
right, my
Thank you.
pleasure. This is Kate Warnock coming to you from the GuideWell Insights Lounge. We are signing off from day 2. Please join us again at our next event. It was a delight being with you all. Thank you.